everyone. I'm Deidre DeGier, special contributor to business publications in DSM Magazine, and I want to welcome you to our fall Lifting the Veil series called Life Interrupted, which looks at the mental health effects of the pandemic and the multiple disruptions of 2020. Today, we will be looking at effective employer and employee tools and techniques to navigate the pandemic. And we have a great program in store for you. But first, I want to share a little bit about how this series came together. DSM Magazine has long been committed to the health and well-being of our community. And 4 years ago, created a publication called Lifting the Veil to highlight the issue and reduce the stigma around mental health. Last year, we added an event. And this year, when the pandemic hit, we quickly realized that there is a need to shine a light on how this situation will have both short and long-term impacts on our community. And we expanded this into an actual event series. The spring events were so well received that we even added more to meet the needs of our community. This fall, looking at the continued stresses of the pandemic, and this thing is designed to really provide concrete tools for each and every one of you all who are watching today. Before we get started, I'd like to thank just a few groups really quickly. First of all, thanks to the DSM team. You all have worked tirelessly in creating and executing this series, from the concept to the stories to finding experts and designing slides, promoting the program. I mean, you all are top notch, and we can tell that you truly care about this community in more ways than one. I also want to thank our sponsors. First, our presenting sponsor, Delta Dental of Iowa, supporting sponsor, Clyde Behavioral Health, also known as Mercy One. I also want to thank our sustaining sponsors in this work, Employee and Family Resources, Make It Okay, Mid-Iowa Health Foundation, Des Moines Pastoral Counseling Center, and NCMEC. Thank you again to each and every one of our sponsors. I especially want to again go back to our presenting sponsor, Delta Dental. Delta Dental, you all have been improving the health and smiles of Iowans for more than 50 years. And I am pleased to introduce April Schmaltz, Senior Vice President of Sales and Marketing at Delta Dental. April, how you doing?
Great, Deidre. Thank you very much. Good afternoon, everyone. As Deidre said, my name is April Schmaltz, and I am the Senior Vice President of Sales and Marketing for Delta Dental of Iowa. And for more than 50 years, Delta Dental has been improving the health and smiles of Iowans. We provide dental and vision benefits to more than 1.2 million Iowans. And as a not-for-profit insurance company, we believe in giving back and investing in our communities. Most recently, Delta Dental and its foundation committed more than $20 million to COVID-19 and derecho relief and recovery efforts. These funds were used to assist our dental providers, support community health centers, and addressed food insecurity issues throughout Iowa. As a health and wellness company, we also understand the importance of physical and emotional well-being. This is why we are so pleased to support the Lifting the Veil series and the important messages it brings to Iowans during this time. Thank you again for joining us today.
Thank you, April, and thank you again to Delta Dental for making this series possible. We really appreciate your contribution, not only to this effort, but everything that you do throughout the community.
Thank you.
So today we'll be focusing on the workplace. If you missed our last one last month, go back to DSM Magazine on Facebook to check that out. But we talked about parenting, and we were talking about parenting. The workplace kind of squeezed itself in. So this time we're talking specifically about the workplace and how employers and employees can successfully navigate the mental health strains of this pandemic. And so this is how this program is going to work. I'll introduce our expert guests, and I'll share an audience question to them. Our experts will have an opportunity to answer the question and to also provide each and every one of you all with tools and techniques to help you. We'll take several questions and we'll repeat the same format. We're going to take, I believe, 4 questions today. I'm pleased to be joined by our expert guest, John Couture, Senior Vice President and Chief of Human Resources at Principal Financial Group, Peggy Hubbard, Executive Director of NAMI, Rosalind Fox, Factory Manager at John Deere Des Moines Works. How y'all doing today, panelists?
Good.
Thank you so much again for taking time out of your busy day. You all do a lot of great work in our community and within your organizations. Are y'all ready for the first question?
Let's do it.
All right, let's hear the first question from Sue Woody.
Our management team includes parents of young children who are struggling to balance remote work with parenting. What can we do to support them?
So the question again is, what can we do to support employees who are struggling to balance working remotely and parenting? John, we're going to go to you first.
Yeah, I'm happy to kick it off, and good afternoon, everybody. The first thing I would say before I share some of the perspectives that I have is that Principal obviously is a large employer, and so the things that we've done throughout the pandemic, hopefully they apply to everybody, but they may not depending on your work situation. So with that said, the two things that come to mind, and this will be a recurring theme in terms of the strategies that we can deploy to help our employees work through all the challenges in our environment, not just COVID related, but the environment is pretty fraught right now. And so the word that comes to mind is flexibility. The other word that comes to mind is communications. And so when we think about flexibility as an example at Principal for our non-exempt or hourly employees, right as the COVID pandemic started, we put into place a special pay code. And we know that in particular for hourly employees, there's a big concern about incomes being disrupted as a result of our employees' need to take care of children or their parents or whatever their personal situations are. So we put in place a special code that basically says if you have something in your personal life that you need to tend to that's a higher priority than work, then just kind of apply this code to that time. So it basically took the burden of not having our employees worried about income continuity out. And that provided, what we learned is that provided a huge stress relief for our employees. And then the second thing is really just communication. So while that's a really basic thing, it's very important that, and we encourage our leaders to connect with our employees to understand each person's particular situation, and then do whatever we can as a company to accommodate that employee's perspective. But I know Rosalind and Peggy, you are also on the panel, so would love to get your perspectives on this issue as well.
Well, thank you. And, I think we have to, as employers, as managers, as friends, as fellow citizens, keep in mind what we are experiencing this year, right? It's not just COVID, as you said, John. A lot of other things are going on and are happening. So parents are trying to teach children and work at the same time. And that's especially hard if the child has any kind of special needs, because their supports, their resources have been diminished. We're often trying to support a loved one who is elderly, who is vulnerable, who has a disability, who has a mental illness. We are all missing touch. Touch is a basic human need, and physical distancing is hard. Many people have had a tough adjustment working from home for a variety of reasons. It might not be a good setup. There might be too much else going on, too many distractions. You don't have the right chair. You have Zoom fatigue. There's a lot of things that can be affecting them. And then finally, there's the feeling of helplessness. And that's especially hard for anyone who has experienced trauma in their lives. This feeling that we are isolated, we are physically isolated, but also that so much is beyond our control is very, very tough. So keeping all those things in mind, and I know John, I heard you say this when we were talking before, is granting grace and flexibility, and understanding that these different stresses can result in a lot of different things. Affects our mental health through depression, anxiety, mood swings, irritability, but it can also affect our physical health. Headaches, stomach aches, sleeplessness, low energy, and can even lead to chronic serious illness like diabetes, heart disease, and high blood pressure. So we're all in this boat together, although some are disproportionately affected. They have more things coming at them, more barriers, more issues, and we just all have to understand and try to, like you said, provide help, hope, flexibility, and grace.
You know, Rosalind, John's organization predominantly is in, 90% of them, I believe you said, John, are working remotely. But, at John Deere, Rosalind, you couldn't necessarily move the factory in people's backyards. So, what are you all doing at John Deere, and how have you been able to, be proactive around helping employees balance work and life?
Yeah, thanks, Deidre. You're right. We can't build tractors in our backyards. We have to come here to do that. So, I'm really proud of how the company has stepped up here. Right out the chute, we mobilized and looked at this from a production standpoint, people who come to work and build our machines every day, and how we can best support them. And so, similar to what John spoke about early in terms of the flexibility and pay and having a special pay code, we implemented that as well to support our employees and really providing them that grace that they need to adjust their home life situation if they had kids who weren't at school. And then once we got beyond sort of that initial sort of 60 to first 90 days, then if there were people who still had needs, we had one-on-one conversations and made exceptions. And so the flexibility and providing the grace that they needed, I think has gone a long way for us to help support our employees through this challenging time. So yeah, I think the comments that John made and Peggy made in terms of what we need to do as leaders is to have that empathy and really think about how we run our business differently in this condition during the pandemic versus what would be normal times for us. So, yeah.
And Deidre,
So,
I just would,
go ahead. Go ahead.
Thank you. So I was just going to add, another really important resource that many companies offer is the Employee Assistance Program. And I will tell you, we have an employee assistance program, pretty robust at Principal. We've expanded it to ensure that we have about a pretty significant portion of our population outside of the U.S. So we wanted to make sure that all of our employees globally have access to those important mental health support resources. And one of the things, and Peggy, I'd love your thoughts on this, that we found is despite the fact that we have a pretty robust benefit in this area, actually a very low percentage of our employees are taking advantage of it. So it's a resource that's there. We're making an investment in it. You can have access to people that you can talk through about anxiety. There's online resources, there's learning. And we're just a little bit surprised that few of our employees take advantage of that resource. And we're thinking that part of it is some of the stigma that is unfortunately attached to mental health. And Peggy, I don't know if you have a perspective on that, but that is another big support mechanism to help our employees.
Oh, you're right. But you're not alone. It is universally not a well-used resource, unfortunately. And part of it certainly is stigma. Part of it is not completely understanding what the benefit is and how it could help them. So just like NAMI, which is not a clinical service, but a peer-led, people with lived experience helping each other. The key to it, I think, is education and giving examples, of getting people who have used it to share their positive experience and how it's helped them. The big thing about stigma is that it thrives in silence. So the more we talk about it, and the quote I saw earlier about bringing it out in the open sunshine, not feeling a shame attached to it. We find that if leaders in a company talk about their own experiences, that is very powerful. NAMI has a program called Homefront, which is specifically for families of active duty military and veterans. And we actually have offered it on a few military bases to active duty military. And what they found is that literally no one will sign up unless the CO signs up or unless the CO's spouse signs up. So
that's kind of the framework we see in our community contributions, our donations. You know, the CEO says, I'm going to give this amount of money, and then, you know, everybody does it. Peggy, you're actually leading us into our next question. So let's pause real quick, and then we'll get this next question out, and then we'll come right back to you because I know you have a really good answer for it. This is Daniel.
Our workforce includes individuals with diverse experiences, including immigrants, maybe their first language is not English, and many other experiences that add additional layers of stress to them and their families. How can we as employers support these individuals with different experiences and challenges during this pandemic?
You know, Peggy, one of the stats that I read about NAMI in their studies is that 1 in 5 individuals struggle with mental illness. And last month, 41% of folks, the CDC did a report, 41% of folks are reporting that they are having a challenging experience as it relates to their mental health. And, you know, you spoke about earlier how this is compounded, these challenges are compounded in diverse populations. Can you speak to that a little bit?
Absolutely. Well, it's now 1 in 4. That's what the pandemic has done for us. It's 1 in 4, and which really means that 4 in 4 of us are affected in some way. And we might not always see it, but it's there. Sometimes it's below the surface. So I think from in terms of employers, but also as colleagues, we can recognize that COVID has not affected everyone the same. It has disproportionately impacted people of color, people who have jobs that require them to be out in the public all the time. And they've been much more at risk. And so that they've been exposed to the disease, and they've contracted the disease, and they've died from the disease in larger numbers. But when you don't have a lot of support or resources in your life, everything can be a crisis. So, right, if your car breaks down and you don't have the money to repair it, and then you can't get to your job, it's a cascading effect. Well, the same is true with COVID, with illness, whether it's you or a family member, and then often it becomes it spreads. That has ramifications, economic, psychological, all kinds of things. And I just think we have to recognize that it's real. It's not made up. It's not people whining. It's fact. It's the way it is.
Mm-hmm. You know, Rosalind, you're in a factory with some diverse folks and some hard workers. You know, how are you connecting to meeting their needs right now?
Yeah, absolutely. You know, I just think as a leader here during this time where we're still asking people to come to work and during this pandemic, we have to be dialed into how they're feeling, being transparent, frequent communication, you know, up and down throughout the leadership chain. And so, you know, my entire leadership team knows, you know, when we've got free time on our calendar, we're out on the floor, we're having conversations. We are wanting to understand and having those one-on-one conversations to understand where people are in terms of their mental health and their well-being. And you can only do that by having those one-on-one conversations and understanding what their needs are. And we try to help them talk through some potential solutions, whether it's professional help or whether it's needing a couple of days off to take care of themselves. But leaders have to have the one-on-one conversations and be dialed into what the employees are experiencing. Otherwise, we can't provide them good solutions and good help. And then we'll have a bigger absenteeism problem if we don't, right?
As you're describing this, I was thinking about that hit show Undercover Boss, when they put on the disguise and go on the floor and they get engaged. But you're saying now, don't be undercover.
Don't be undercover.
Out front, in person,
Need to be out there and visible. Yeah. And, and it's not just me. I mean, even though I'm the factory manager, my entire leadership team, we walk the line every day. We ask questions. How are you doing? What can we do differently, right? What can we do differently from a COVID protocols implementation standpoint? And just get that feedback and let them know that we are in it together. You're not out here putting together these machines by yourselves. We're here to support you and help you in whatever way that you need. So you got to have the conversation with them.
John, you got a global company. You got a global company that you're working with, and the challenges throughout the country here look sometimes differently in other parts of the world. I mean, how are you all coming to terms with your problem solving around this?
Yeah, so thanks, Deidre. I mean, a couple things come to mind. The first one is, as part of our global inclusion strategy, we have employee resource groups, right? So when you think about Daniel's question, it was specifically about specific groups of people, and how do you find commonality, and how do you find people who understand your lived experience better to have conversations with. And so we found that our employee resource groups, which are groups of people, either allies, people of color, people with disabilities, veterans, common experiences, bringing those people together to talk about the unique issues of those groups of people as we're working through the pandemic. So we definitely think that is an important part of addressing Daniel's question. And then the second thing, which Rosalind talked a little bit about, is a different form of communication. So we use what we call pulse surveys, which are very short, frequent surveys as part of our employee listening approach, where we're reaching out to employees, and it just takes 30 seconds to fill out a survey. It's not it doesn't consume a lot of time, but that gives us information around themes that we need to be thinking about, concerns that our employees have. And it's really helped us to very quickly understand what the concerns of our employees are across different segments of our population, as well as put those solutions in place faster, because we're listening in virtual real time.
How often are you doing these pulse surveys?
All the time. So I would say weekly, we're sending surveys out in some form or fashion. And again, the key is that they're short, and we're sending them out to different portions of the population. So it's almost a random sampling of the population, frequently surveyed.
Mm-hmm. Peggy, I want to go back to you. There was a question in the chat about folks in the nonprofit sector, and they're geared towards giving and caring for individuals as employees. And Renee Hardman mentioned, how do you address care fatigue when folks are so used to pouring into others? How do they connect with their own mental health challenges that they may be having, or the challenges may be on the horizon?
Well, that speaks to the importance of self-care and understanding what that is for you. There are a lot of components to that can vary from person to person, but some of the basics are nutrition, exercise, sleep, finding a routine, creating your own support group, whatever that is, of people who can recharge you, replenish you, listen to you vent if that's what you need to do. Things like yoga, meditation, spirituality practice. I would be derelict if I didn't talk about the value of community sports like NAMI. So we are people with lived experience, people with a mental health diagnosis, or loved ones of those people who are trained to help others. And that's what NAMI is all about. So understand when you need to reach out and ask for help. That's not always going to see a psychiatrist, right? It might be that, it might be going to therapy, but it also might just be joining a support group or taking a class to learn more about the illness, or how you can be a better support person, or how you yourself can get support. from people who have been in your shoes, that can be really a lifesaver.
Mhm.
Yeah.
Awesome.
I like to add a little bit there as well. And I think, again, as leaders, sometimes people don't realize that they're in a situation where they need help and therefore may not even go out and seek help. And so I think as leaders, it's important to be dialed into when you start to see those behaviors where the performance isn't there like normal, or they're late to meetings quite frequently. You have to be dialed in and be able to have the courage to have the conversation with the employee and say, hey, is something going on? You know, do you need a mental health day or 2 or 3, right? And so, you know, because again, especially in operations where we are running hard every day, people get into the habit of running hard and not realizing that sometimes they need to be told, hey, you need to take a day or 2 away to recharge your batteries and re-energize and come back fresh. So I think it's just important to recognize that sometimes people need that help and that coaching as well, because they may not understand that they need to do some self-care.
Mm. John, you had something?
Yeah, I was just going to add to Peggy's comment. The thing that really resonated for me is the idea of setting up a routine and building breaks into your schedule in order for you to be able to continue to work, right? So we're in kind of a hyper productivity environment right now. And while most people can do that effectively for some duration of time, it is definitely not sustainable. And so we heavily coach people to figure out when you need breaks. You know, if we're operating in this virtual environment, in our world, you know, we have about 95% of our population that's working from home on camera between 8 and 10 hours a day in this environment. And it is stressful. It can have an impact on your physical well-being as well as your mental well-being. So that establishment of routines is really important.
John, I think you said a very, very key word. Everything you just said was great, but what stood out to me is the hyper productivity space that we're in right now. How can employers help create balance in that so that employees don't feel so obligated to meet standards that may not necessarily be realistic right now?
Right. Some examples that come to mind right away are things like no meeting Fridays. You know, you get into this environment and because there's no physical interaction with people, your schedule can literally be, you know, either an hourly or half-hour increments, just one meeting after another. So the combination of planning that routine and those breaks into your schedule is definitely one way to do it. And so I'd be interested in perspectives from Rosalind and Peggy on this as well.
Of course.
Yeah, I think for us, you know, sometimes you just have to people know what the policies are in terms of a compressed work week and the opportunity to work remotely, but sometimes you just have to remind them, take those advantage of those opportunities, because, you know, they get into this environment where, you know, they're hitting the pavement and doing the tactical work every day, and then they forget that we have these benefits. And so I think we have to make sure that we remind them of, listen, you can work remotely and still be productive, right? And so it's just reminding them that they've got options to help cope.
So I'm also an employer. We have a small staff of 7 at NAMI, Iowa. And as you might imagine, we have a lot of challenges because of the population that we deal with. And sometimes we get screamed at and blamed for a lot of things that are going wrong in people's lives. So that can be very stressful on our staff. And so I will admit that when the pandemic hit, we have people on our staff who live with a mental health condition. So we had some people who were really struggling, and we took the time to talk through it, essentially kind of group therapy. We talked about what each of us was doing to cope. We talked about granting each other grace, about finding something every day that we could find joy in. that made us feel happy and productive and contributing, like we were, progressing and making a difference, of finding other things maybe farther in the future that we could look forward to and plan toward, and about just reaching out for help to say, I know you wanted this done by the end of tomorrow, but I am just not going to be able to do it. I can't, and here's why, and as their manager or, someone else on the team, that we say, okay, that can wait for another day. So we got through it, but that's what it took.
Peggy, I was just going to add that, that last point around deadlines, one of our big learnings is in a pandemic, in a situation like this that so changes how people are working, it's been pretty remarkable to understand when people set arbitrary deadlines or real deadlines.
Yeah.
And so we've talked a lot on this call so far about grace, and deadline relief is a big enabler of grace. So really looking at, does this actually have to be done on this particular date at this particular time, or did we just make up that date and that time because that's when we want it done? And if there can be flexibility around that kind of thing, it really provides a lot of relief for our employees.
Yeah. And I think that probably also presents a space to challenge employers to do a great deal of long-term planning. That, it's not month by month, but we're thinking about these projects in a long-term way. And so the deadlines aren't so arbitrary. Rosalind?
Yeah, I was just going to add, for me, it's been like, okay, so I need to stop doing this so I can focus on this. And so, it's not only about deadlines, but what are the things that are critical to keeping the business running versus things that you do because it's what we've always done kind of thing. I think we have completely sort of reshifted our focus in terms of what's required and what's desired, right? From a business standpoint. So as challenging as the pandemic has been, there have been some bright spots that have enabled us to think differently about how we run our business and what we should really be focusing on.
Awesome. All right, we're going to go to the next question, and this is from the guest.
My question is, what is the probability that HR personnel is conscious of their implicit biases in their discussion with onboarding and retaining a diverse workforce?
So this is something that we're seeing, Peggy mentioned it earlier, how people of color and disadvantaged populations have been impacted by the pandemic in some other challenging ways. And throughout our entire community, we've been having discussions about implicit bias. And I think it's important that we also bring this up in the course of the conversation as it relates to the pandemic, because implicit bias can have some mental health effects, challenging mental health effects. And we're going to start with you on this one, Rosalind.
Yeah, you bet. So, I think the probability is good that HR is very aware of how the pandemic is affecting people's bias as it relates to the pandemic and hiring practices. As you mentioned, Deidre, we know people of color are being affected by the pandemic at a higher rate than everyone else. And so that, along with the recent social injustices and inequality and equity issues that we're experiencing here in America, you can't help but to know that HR is dialed into these things and are working on how we look at biases different going forward. And so, I think from a John Deere standpoint, some of the things that we've been doing as it relates to making sure we check our biases is we've been having workshops. We've started a cohort called Men as Diversity Partners, where we have, obviously, John Deere is made up of mostly white men, and they have been willing to have a conversation around biases and checking those biases when it comes to looking at candidates for hire, when it comes to a candidate list, making sure that we've got diverse diversity represented adequately and equitably on those candidate lists. And you know, this is honestly a conversation that we didn't have 10 years ago, but we're having it more frequently now. And rather than it being a push, it's being a pull. People are engaged and want to be a part of the solution, and the HR is helping us drive that. You know, some of the other things that we've been working on is, you know, just making people making sure people have the empathy because of how people of color are being negatively impacted by the pandemic and the inequity issues. Just creating more awareness and conversations and space for that in the workplace. And that for John Deere is something new that we just started doing this year, is having group conversations around racial diversity and the inequities that we experience and we see here. So the other thing I would say is important is outreach to our outreach to professional organizations like National Society of Black Engineers, Society of Women Engineers, Society of Hispanic and Professional Engineers. I mean, these are things that we're really trying to do to help make sure that we get the candidates, make sure that we've got great lists, and again, continuing on with the workshops around implicit bias so that our employees and managers can be trained and well-informed on how to check those biases when they go into discussions around hiring, promotions, and movement within the organization. Sorry, a long-winded answer, but this is so important. I wanted to make sure that I got all my points across, but I'd open it up to John and Peggy for additional comments if there are any.
I'm just so glad as an HR person, I'm glad you think HR is dialed in. So that was good news from my perspective. I am biased on that as an HR person, but I do tend to agree with you. Well, but all joking aside, I mean, I think you hit the nail on the head. So we were fortunate to, within the pandemic is unfortunate, but in the pandemic, we had already planned to roll out a global program on unconscious bias training. And we partnered up with the Neuro Leadership Institute that takes basically a very scientific approach to understanding how we as people, all people, have bias in our decision making, how we hire talent, how we interact with people, why we make the choices that we make. And so that has actually been hugely positive in terms of understanding each other better, understanding the issue from a fairly objective perspective, right? Because there's a lot of tension in our system right now around social equity. And this approach that we've learned from and are embedding in our organization really takes a science-based, like this is how your brain works. And these are the strategies that you can deploy in order to minimize the type of bias that exists in all of our systems, in all of our lives, not just at work, but at home. And one of the things that we're very proud of is in rolling out that training, because a lot of these trainings can kind of come and go and they're kind of a program, but we've been very impressed with how we're incorporating the language of unconscious bias in our work. So when we're talking about, a presentation that's starting and it's going to require us to make a decision, before we get into that decision-making process, we pull in the training that we've had on how biases can creep into decision-making processes. So Peggy, I don't know if you have any thoughts as well in this space, but this is a very important area.
Yeah.
Well, I do. And in fact, we are having a session on implicit bias as part of our annual conference, which I just put a plug in, November 20th. It's free. Go to our website, namiiowa.org, and sign up. Because it exists in the mental health space as well. And in fact, the person most likely to be involved in a violent altercation with law enforcement is a Black male. So it's racial bias. It's along with being in a mental health crisis can put you in harm's way sometimes. So there's also bias in the system. There's greater stigma in certain, in cultural stigma in some different racial and ethnic and cultural groups. talking about it in different ways. You know, there are some languages for which they have literally no word for mental illness. So, you know, we have to recognize all that. And
can you talk a little bit more about that? I think that's a really important point,
Sure.
especially culturally.
NAMI Iowa is a white, female, middle class based organization. That's where it started. It was with a bunch of moms in Madison, Wisconsin, who decided they needed to do something because their adult children with schizophrenia were not getting proper care and they didn't know what to do. Now, we've made a lot of strides in the last 40 years in broadening that and diversifying. We still have a long ways to go, but there's a lot of distrust on the part of for good reason, of the medical system and of the CDC came out with a big study 2 years ago on suicide. And they found that about a quarter of all people who took their own lives had close friends and family members who said they had no clue. They didn't see it coming at all. They had no idea. And you know who that quarter were disproportionately? They were young males of color. Because they weren't talking about what they were going through. I always say my demographic, white women of a certain age, generally have no problem seeking help and getting the help we need, talking about it. But a lot of people do, and that's what we need to focus on and talk more about.
Appreciate you sharing that. All right, we're going to go to our very last question from Kate.
Many employees are finding it stressful to work remotely or maintain social distancing. How are employers helping their teams manage the anxiety that comes from so much change to work styles?
So, you know, work styles, that's a loaded thing right there. So let's really focus the attention on, you know, how people are working, where they're working. There was also a question in the chat speaking to those employers who are in retail, who are having to make budget cuts, and there's anxiety that's coming around, you know, folks logging in or coming to work and realizing their schedule's been cut for an entire 30 hours or 20 hours, whatever they may look like. Anxiety is actually existing in so many of our communities as it relates to just the uncertainty that exists. And we'll start with you on this one, John.
Yeah, thanks, Deidre. I mean, I go back to the flexibility point that I started with, right? So, I mean, and I really think this applies probably to all companies. We just happen at Principal, we're a company where the vast majority of our employees can work from home. And for companies that have employee populations like that, one of the things that we know across the board from a data perspective is that after the pandemic, I mean, during the pandemic, but certainly after the pandemic, there's going to be a big portion of the population that expects to have what is called a hybrid work style, which basically means employees are going to fluidly move from going into the office and doing work to sometimes working remotely or at home. And it really is going to turn how work is done on its head a little bit. We know that there's going to be some portion of the population that prefer to work remotely all the time. There's going to be some portion of the population that prefer to work in the office all the time. But the biggest piece of our employee population going forward is going to be that hybrid mode. And the challenge for, like, when you look at Rosalind's population, where you've got folks that do have to go into a physical plant and have to produce work, for the portion of our population that is in that category, we're stepping back and really challenging how we apply flexibility to those employees as well. Shifts coming in and out of shifts, instead of thinking about work in a full 8-hour day, can that be broken out? So there's a lot of really exciting things happening in this space. And Rosalind, I think you mentioned it earlier that while the pandemic has been horrific in so many ways, there's also quite a bit of silver lining in the pandemic in terms of challenging how we get work done and how we enable our employees. And actually, one of the things we're experimenting with at Principal is, you know, a lot of our companies, or hopefully most of our companies, spend a lot of time thinking about how to serve customers and to basically wrap what the company does around what the customer needs, we're starting to think about our employees in that same way. So how do we take the work that we need to get done and wrap that around the needs of the employee? And we think long-term that's going to be a winning talent strategy for us. But would love to hear from Rosalind and Peggy on this as well.
I can speak from personal experience. Although we have all been working remotely at NAMI, Iowa, I have 3 young adult children who all are in very different professions. My oldest daughter is a retail manager, and is 7 days a week, sometimes 12 hours a day that they need to be staffing. After a short furlough, they were brought back, and she was terrified, that she was going to contract the illness and she was going to pass it on. And there were a lot of fears around that. My other daughter is a vet tech. So she's in definitely a crucial service. And by the way, veterinarians have one of the highest rates of suicide of any profession. A lot of stress, a lot of caring for people and their pets when it's, often the end of life, and it's very difficult, but you have to be there, and you have to be there for them, and you can't do it remotely. And then my son is an attorney in the DC area, and he's been able to work completely from home. So does he have stress? Does he have deadlines? Yes. But it's a completely different kind of experience from my 2 daughters who have to be there every day, and also deal with their coworkers. And they've had coworkers who have gotten the virus, and then everyone's scared and they all have to get tested. And, it's really a roller coaster. And it's, as a manager, it is very difficult. So I understand that perspective. And again, all I can say is talk about self-care, be flexible, and be, as Rosalind said earlier, be tuned in to when your employees are veering off track, and pick up on that, and then intervene and see what you can do to help, and for them to seek help.
And this has been an interesting dynamic for me, having to run the factory and yet still having people work remotely as well. And so I've had to try to balance, how do I manage the anxiety on both of those ends? And certainly, when I think about and have had conversations with our employees here who are on site every day, similar to what Peggy said, they're worried about, people that they work with potentially getting sick, and how do they protect themselves? And, do we have enough sanitation and disinfecting activities happening in the workplace? And, obviously we're still doing the temperature checks, and now we're mandating masks and everything. And so it's been a challenge for them to adjust, but we're 8 months in now. And I think people have sort of settled into this new way of working. And so now the anxiety has shifted from, okay, so we're here now. What happens when the remote workers start to come back to the workplace? And then having to make sure that they're not bringing in potential additional exposure, or, and how do we help make sure that they come in and establish the habits that we've already been living with for the last 7 to 8 months, right? And so my on-site workers have anxiety about those folks potentially coming back. And so, it's just been an interesting dynamic for me trying to, manage both groups and supporting both groups and the working styles that they've had to come accustomed to, and making sure that we can continue to operate in a way where we're still providing grace and understanding throughout this process. But it has not been easy. But, again, just being dialed into people and their needs is what will help, and help us all move forward.
Awesome.
Deidre, just one more thing very quickly is tone at the top of our organizations matters a lot. And it was mentioned earlier on the call that the leadership in all of our companies, small, big, profit, nonprofit, doesn't matter. But that management team, that leadership team, and the tone that they set around how we support employees, how the leadership team enables policies that are pro-employee to help people out in a really important time of need, it makes all the difference in the world, because there's a lot, in some organizations where there might be kind of I call it happy talk, like the words are said, but the behaviors don't follow. That's not going to be helpful. On the other hand, if employees see their leaders verbalizing the support, putting policies in place so the actions and the rhetoric align, that creates a lot of stress relief for employees because they know they can rely on their management team. So that tone at the top, I think, is very important.
Absolutely.
Really good feedback. Really good feedback. You all have given us some great observations. Panelists, I'm going to come back to you in a second for your 60-second roundup. Imagine you're talking to folks on the other end. You may not be able to see them, but they may be experiencing challenges in managing the folks that they work with, and they want to overcome those challenges. So I want you, we talked a lot about some daunting things today, but I really want you to come back with some inspirational words to give them a little bit of hope. So I'll give you time to think about that. You'll have 60 seconds. But before we go back to our panelists, I want to invite you to our next and our last event of the series that will happen on November 19th. This one will focus specifically on diversity relationship goals and also unveil a stunning publication called Lifting the Veil, which I am super, super excited to see. If you are interested in being a part of this event, please register online at dsmmagazine.com/liftingtheveil-2020. I also want to invite you to subscribe to our newsletters. We are in a digital world right now, and so this is how we continue to connect with each other. You can connect with DSM Weekly, Weekend in Wealth, and our new IA State newsletter. And of course, we'd also love for you to subscribe to the stunning print publications like DSM Magazine and IA. We just had the unveiling last night. It went fabulous, fabulous, fabulous. When you are a subscriber, you get the print magazines, which is very, very key, but you also get the digital newsletters plus special publications like Lifting the Veil. So this is all a bundle of joy to keep you connected and keep you engaged and learning, right? We're in a space where we're learning, and business publications and DSM is doing whatever they can to make sure that we are as informed as we need to be during this time. Now we're going to go back to our experts. You all get 60 seconds. Inspire us. How do we cope? How do we get things done? How do we manage? How do we lead during trying times like this? You don't have to answer it all, but whatever floats your boat. 60 seconds. Go ahead, John. You're grinning. I know you're ready.
Well, you know what? I'm going to give some time back because I want to keep things simple. We've covered a lot of really great information over the last hour. But when I think about the future, I think about control the controllables. This too shall pass. So focus your energy on the things you control. There's a whole bunch of things in our world that we don't control. And sometimes that gets our energy, but there's a lot of things that we do control. And if we focus there, with the passage of time, we're going to get through this. And I really believe, even though I know it may sound like happy talk right now, I really believe we're going to be better off on the other end of this pandemic.
Thank you, John. Rosalind, go for it.
John stole two of my points. So this is good. We're going to be consistent here. So one is, simply just recognize and acknowledge we are in an unusual time, but it's temporary, right? This won't last forever. So if we think about that in mind and everything that we do, we gotta push through it, dig in our heels and just walk through it day by day. The second thing is, I think we need to continue to talk openly, right? Be dialed in, recognizing the changes in people, and just openly talk about it. It's okay to talk about it, to make sure that people get comfortable with what historically have been uncomfortable conversations, because when we talk about it, we can work on it, right? And then the last thing is to focus on the things that you can control, and do that. You know, how do you eat an elephant? One bite at a time, but focus on the things that you have control over and let everything else go to the wayside and deal with it later. So that would be my closing point. But we're all in this together. And as John said, we're going to be better on the other end. So I'm really grateful for this opportunity, and I appreciate the chance to be here with you guys today.
Thank you, Rosalind. Last but not least, Peggy.
Well, thanks, Deidre. I agree with everything that John and Rosalind have said. And I agree with John that we are going to come out better on the other end. And here are two examples. What we've seen, silver linings of the pandemic, the explosion of telehealth, which is really going to help a state like Iowa, where we have a rural population. We don't have enough clinicians. We don't have enough providers. People are getting access to care now that they weren't getting before because of telehealth. And we want to see that keep going. So the advocates are going to be working to maintain that. The other thing is organizations like NAMI that have resisted making the virtual transition, because we're just all about seeing each other in person and hugging and, you know, just being there for each other. We have been forced to do things now in a virtual way. We've made more progress in 6 months than in the previous 6 years on both telehealth and transitioning to virtual education and training. And, you know, we just had an event for peer support specialists from across the state. We had 65 people, and 35 of them said, you know, I couldn't have done this if you'd had this in Des Moines, because I don't have transportation. I don't have gas money. I don't have, I can't drive. I don't, you know, all kinds of things, but this I can do. I can get on Zoom and spend a day learning and being engaged and connecting with my, my peers from across the state. So I know, multiply that times 100, right? We're just one organization, but we're reaching new people and more people because we're doing things in a virtual format, and that's a good thing. Do we want to get back together in person at some point? Of course. But right now, we're making the best of a bad situation, and actually there are good things coming out of that. So I also want to make sure that as employers and as friends and colleagues, we know resources that are available. And I don't know, I provided that, I don't know if we have it somewhere, but 211, a great resource. Your Life Iowa, another great resource. And those are 24/7, 365 available. They're anonymous, so anyone can access them. But also 2 really great resources for you to consider in the workplace are Make It Okay, which is a fantastic educational program with Healthy Estates Iowa. You can get trained to be an ambassador. You can have it in your workplace. It's all about reducing stigma and raising awareness of mental health. And then we have a program called Ending the Silence, which is also a really terrific overview and introduction to mental health issues. So all those are great resources, and you know, I hope you all familiarize yourself with them and make sure that your employees and your colleagues and your friends and neighbors know about them as well.
Thank you so much, Peggy. And thank you again, John and Rosalind, for offering your time today to share to the folks who are listening. Folks, you know, before we go back to our sponsors, if there is anything that I've heard today, is that the challenges that have been brought upon us in 2020 don't discriminate. The challenges are transcending race. The challenges are transcending socioeconomic status. We see people experiencing this in the workplace, from leadership all the way down to entry-level positions. But if I have heard anything from these folks today, it's that our village has been expanded. We're all in this together, and we can overcome it together. We just have to stay dialed in, and we have to control those things that we have the capability of controlling, and set realistic expectations. And overcoming it's on the horizon. Again, thank you to all of our sponsors, our presenting sponsor, Delta Dental, our supporting sponsor, Clyde Behavioral Health, also known as Mercy One. It's our sustaining sponsors, Employee and Family Resources, Make It Okay, Mid-Iowa Health Foundation, Des Moines Pastoral Alliance, Des Moines Pastoral Counseling Center, and NICMIC. Thank you to everyone who tapped in today. Don't forget to join us next month for another one of these. We really appreciate your time and have an incredible day.